Canadian lab director who leads by example. We continue our celebration of Canada's Lab Week with her story. Plus, spreading the word about the less common complications of measles. This is the Path News Network Daily Edition from the College of American Pathologists. I'm Elizabeth McMahon. It's Thursday, April 16th. Next week, laboratory teams in the U.S. will celebrate Lab Week, recognizing the vital contributions these professionals make to healthcare. But first, Canadian labs are doing a little celebrating of their own during National Medical Lab Week. Among them are the labs of Ontario's University Health Network, or UHN. That's where Christine Bruce is Senior Director of the Laboratory Medicine Program. It employs about 700 staff and serves more than 1,300 patients daily. Bruce says one of her team's strengths is supporting labs in remote parts of Ontario, which stretches north from New York to Hudson Bay and west to Manitoba. These regions have struggled with staffing, especially since the pandemic. Her team used a model UHN established nearly 2 decades earlier with a cluster of 11 hospitals in the Timmins region, an 8-hour drive north of Toronto. That effort became a working model for training technologists and installing digital solutions in labs as far away as the Manitoba border.
I mean, we're trying to serve 60% of Ontario's landmass where only 5% live. It's really, really challenging and a lot of things need to be considered. But why it works so well is because everybody involved is super committed to figuring out how to make it work, right? They've gone this long just trying to band-aid solutions together. And so we're trying to introduce some of the, I don't say riches in a sarcastic way or anything, but there's a lot of haves in the South, and we're trying to help the have-nots in the North and to really give them the same standard of care that everybody is really entitled to.
Keeping UHN labs digitally connected, supported, and serving patients across an area bigger than France and Spain combined is a challenge that Bruce and her teams relish.
If you can work with a partner that can somehow create a just-in-time, I can jump in and help you with this in this moment, and you can continue to do the rest of the work, and we can help you try to keep your lights on. We can keep you together until you've got your feet back under you for whatever reason. That's kind of the business model that I'm certainly trying to lead the team through, because we don't want to ever be perceived as, we're just going to, take over or something. That's not the goal. The goal is to inject health into the system and give people time to rebuild or to recruit or whatever the pinch is.
Improving Ontario's lab services isn't just work she does from her desk. She lives it, too. Frustrated by the complexities of dialysis and the long waiting lists for kidneys, she decided to donate her kidney anonymously in 2024. Moving through her own lab tests on the way to surgery, Bruce lived the uncertainties that lab results can create for patients.
But when you're a patient, like really, really in the environment, and you're about to have surgery, and you know that there's this person who's relying on you to get through all of this, all of those little hiccups become that, like, oh my God, what if this is the thing that kicks me out of the pipeline? What if this sort of misrepresented urine culture sample that was absolutely right, but there was one word that was wrong because we free texted the result instead of letting a canned message go through as a result. What is this is the thing that's going to kick me out of the program or the matching process? So all of that just made it that much more acute, like, oof, I need to figure out how to support the team to do better while they're already doing awesome.
Her journey as an organ donation advocate doesn't stop there. With a 2-year clean bill of health, Bruce has been cleared to donate part of her liver. She'll be taking copious notes for her laboratories along the way. It's almost here. The CAP Pathologists Leadership Summit in Washington, D.C. starts April 25th with 4 days of learning and advocacy training. Start your first day with the Practice Management Workshop featuring sessions on digital transformation, tackling toxic team dynamics, and innovations to increase efficiency in anatomic pathology. Dr. Cedric Bailey, Vice Chair of the CAP Practice Management Committee, says his committee members were inspired by how they could apply efficiencies they saw in clinical pathology to other areas.
We've all kind of seen the Ford methodology, Sigma 6 methodology, all those very intensive production-based methodologies applied to clinical pathology, and they are wildly successful and wildly popular. There's very few practices that don't leverage those kinds of strategies. But we saw that mostly in CP, and we kind of were talking and wondering to ourselves, what if we can get a few experts to discuss that kind of innovative approach to efficient, almost production line manufacturing style efficiencies in anatomic pathology.
Dr. Bailey is with Cedars-Sinai Medical Center in Los Angeles. There will be plenty of time to talk with experts like him during a Q&A session. Register for the summit at the CAP's homepage. Finally, as measles cases continue to make headlines daily, physicians are warning about the longer-term repercussions that can crop up years after recovery. In a recent episode of the Radio Health Journal, Dr. Benjamin Bradley, vice chair of the CAP's Microbiology Committee, discusses some less common complications that can be fatal, including subacute sclerosing panencephalitis, or SSPE, that can surface 5 to 10 years after recovery.
It's this progressive neurological deterioration. So it makes it difficult for people to move, to speak, to be able to think clearly. And generally over the span of about a year or so, patients die from this.
Dr. Bradley, an assistant professor of pathology at the University of Utah, also warns that measles can wipe out what he calls the body's antibody deck of cards that a person develops to different pathogens.
What we've observed in patients who have had acute measles virus infection is that kind of deck of cards, that repertoire that they have. The measles virus sort of reduces the cards that are available to them. It essentially lowers their antibodies to all of these other pathogens that they've developed immunity to.
More than 30 states have reported measles cases to the Centers for Disease Control so far this year. That's all for today's Daily Edition. Be sure to check the show notes for more information on today's stories. Got a story you'd like us to cover on the Daily Edition? Write to us at stories@cap.org. We're back at 5 a.m. Eastern for another episode of the Daily Edition. I'm Elizabeth McMahon. Have a great day.